Can you discuss mixed deformity cases with both excavatum and carinatum and the treatment plan for someone that has both?
Most of the time when people have a mixed deformity, unless it's arcuatum. So if they have arcuatum, it's a completely different beast. You have a deformed sternum that's fixed and calcified. That you actually have to cut to fix. But if you look at mixed deformities as far as Pectus excavatum, most of those are mixed because the sternum is rotated and turned. One side's helped out, the other one's dropped down. In that case, how old the patient is affects what you're able to correct. Because if they're young, if they're a teen, you have the option of putting bars underneath to push the lower side out. And then you can try to reduce and compress the elevated side. That can happen with, there are surgeons that do the sandwich technique or they do the double bars. Or for us, we actually, if you have a bar and this is the hump underneath, we take the fiber wire and we wrap it around and we actually force it down each rib all the way down the elevated side to make them equal. We also drill through the sternum to force the sternum to flatten and drop down and support underneath the bar. Now, in an older patient, if when that's all calcified, a lot of times the sternum won't turn, the ribs will break off, or you can't get it completely even. And so you have a choice. Are you going to start cutting and plating to force that out? We still use bars underneath, so it's not really a true ravage, but it's much more complicated because you can't get that elevated side to come down and the bottom up as easily without breaking things. And so when I see an older patient that has a really turned sternum, I tell them, there's a 20-30% chance I'm going to break something trying to force your chest up. And you may still have a little, not a huge hump, but have some residual asymmetry. If they're like, that's the worst thing ever in the world, then I'm like, okay, well, then you're looking at me opening this and making cuts because there's no other way I'm going to be able to get you up. And most patients don't need a full ravage. Maybe it's one or two ribs that need to be cut to get them up. But, it's very different. And age does affect that when you have asymmetry.